So today we are going to see lead poisoning. This is a very important topic, and it is aka the plumbism as well as the Saturnism. So this is the topic. So the questions being, what is the route of absorption? So route of absorption of lead toxicity. And next question being, what is the mechanism of action of the lead poisoning? Thirdly, what are the characteristic findings, the clinical features of the lead poisoning? So we'll find out the answers to these questions and learn in detail. So firstly, we are looking at the source of the exposure. So source of exposure is, it can occur either with occupational source as well as in case of use of the lead paint. Then looking at the route of absorption. So route of the absorption. So this is, it differs in case of the children as well as it differs in case of the adults. So in case of the children, it is mainly by the GI tract. Whereas in case of adults, it is by the respiratory tract. Next, we look at the mechanism of action. So mechanism of action is that it binds to the sulfhydryl, the sulfhydryl group. So what does the sulfhydryl group does? It inhibits the ALA dehydratase. It inhibits the ALA dehydratase as well as the ferrochelatase. So it inhibits these two, that is, it binds to the sulfhydryl groups, and next what it does is it inhibits the ALA dehydratase along with the ferrochelatase. So now moving on, it also inhibits, there is something else it inhibits, it also inhibits the pyrimidine 5 nucleotidase. Then it also competes with the calcium. So now we are going to look at the organs which are affected due to the lead. So organs affected, this is nothing but acute toxicity. So in case of acute toxicity, organs affected, it includes the GI tract, next the bone marrow, as well as the peripheral nerves. So next we are looking at the organs affected, and this is in case of the chronic. So in case of the chronic toxicity, what is affected is the CNS as well as the kidney. So now we are going to find the characteristics findings, that is the clinical features of the lead poisoning. So the mnemonic here is A, B, C, D, E, F. So we'll be seeing each one of them. So what does A stand for? So A stands for the anemia with the basophilic stippling. Next is B. B stands for the Burtonian line. And what this Burtonian line is, that it is the blue stippled line on gums. Blue stippled line which is present in the gums. Next C. C for the constipation as well as the colic, that is nothing but the abdominal pain. Next we look at D. D for drop. So what is this drop? It is nothing but wrist as well as the foot drop which is seen. So wrist and the foot drop is due to nothing but the neuropathy. Then we look at the letter E. E for encephalopathy. So encephalopathy is mostly seen in case of the infants, and they present with severe ataxia, and it also deals with the vomit and lethargy. Next, it also includes the stupor, convulsions, as well as coma. Then looking at F, it stands for the facial pallor. That is the earliest sign. Now looking at the diagnosis, it is the blood lead levels. So how is the treatment? The treatment is by the calcium EDTA as well as the succimer, that is DMSA. Now this was about the lead toxicity. So now we are going to look at the answers to our initial questions. So initially we asked what is the route of absorption in case of the lead poisoning. So there are two routes. There is for children as well as adults. So in case of children, it was the GI tract. And in case of adults, it is nothing but the respiratory tract. So next question was, what is the mechanism of action? So mechanism of action is that it binds to the sulfhydryl. It binds to the sulfhydryl groups. And what it does is that it inhibits, there's inhibition of the ALA dehydratase. There's inhibition of the ALA dehydratase as well as the ferrochelatase. There is inhibition. So it binds to the sulfhydryl groups and it inhibits ALA dehydratase as well as the ferrochelatase. Next, there is also inhibition of the pyrimidine 5 nucleotidase. And next one is that it also competes along with the calcium. So it competes with the calcium. The last question we asked was, what are the specific clinical features in case of the lead poisoning? So here there's a mnemonic, that is A to F. So we are going to see it. So A for the anemia, and this is along with the basophilic, this is important, basophilic stippling. Next, B for the Burtonian line, and this is nothing but there is a blue stippled line. There's a blue stippled line which is present in the gums. Next we look at C for the constipation. So the patient presents with constipation as well as there is colic, that is the abdominal pain which is present. Then we look at D. D is nothing but there's drop in the wrist as well as the foot, and this is nothing but due to the neuropathy. Then we look at the letter E. What is E? So the letter E, it is for the encephalopathy. So encephalopathy is mostly seen in case of the infants, and the infants, it presents with the severe ataxia. There is severe ataxia as well as there is vomit. There is presence of the lethargy as well as stupor, convulsions, and presence of coma. So all this is present in case of E for encephalopathy. Then F stands for the facial pallor, and this is nothing but the earliest sign. This is important to know. It is nothing but the earliest sign which occurs, that is facial pallor.